Moving one step closer to getting emergency use authorization, an FDA committee overwhelmingly voted yesterday to recommending the Pfizer vaccine for kids between 5 and 11 years old.
Approval could come from the CDC as early as next week. And tonight, a local pediatrician weighs in on the shot's safety. News 8's Heather Hope also spoke to a parent for their perspective.
Yes, following today's FDA panel recommendation, pediatricians say getting these younger school-age children vaccinated could be one step closer to normalcy for them. We talked to one parent who says getting his small children vaccinated is a top priority.
The immune system works fantastic in young kids. It works so well that their dose is actually smaller than the adult dose, and it works great.
Excited that getting approval for the Pfizer COVID-19 vaccine for kids ages 5 to 11 is now one step closer to becoming a reality. Pediatrician Dr. Jamie Friedman in Forest Ranch says the shot is a good idea for small children.
Their bodies can handle vaccines. They obviously get other vaccines and they do just fine. I think the important thing to remember is that COVID is not zero risk in these kids.
For hours, the Food and Drug Administration Advisory Panel weighed in on the vaccine safety.
I work at a children's hospital. Our hospital has been full for the last month or so.
Ultimately, the 17-member panel voted unanimously that the vaccine's benefits in preventing COVID-19 and the younger age group outweigh any potential risks or side effects.
Dr. Levy voted yes, Dr. Fuller voted yes, Dr. Hildreth voted yes.
Carlsbad parent Sean Mahoney is happy the FDA panel recommends the shot.
It's about time, unlocking the vaccine for that age group and that many millions of people. I think that can only help us get back to getting our lives back.
Sean enrolled his 6-year-old daughter Layla in the Moderna COVID vaccine trial.
At first, we said, no way are we going to experiment, on our kids. But as we looked deeper and deeper into the science, we really came to the conclusion that they have a very good handle on this.
Layla has brain cancer.
Hi.
The 6-year-old finishes radiation next week, and Sean feels protecting his little girl from COVID is the best thing he can do.
The data has been very robust that these vaccines are safe.
As the weather changes, Dr. Friedman says even kids who have had COVID should get the vaccine to best prevent getting severely sick from it in the future.
This is just one way to get those masks off, get kids back to normal, and keep them safe.
Following today's FDA panel recommendation, it will then go before the full FDA agency before the CDC will take up the matter starting at its meeting on Tuesday. Heather Hope, News 8.